Hey everyone, today we're going to decode three little letters you've probably seen on a lab report, BUN. That stands for blood urea nitrogen. And, it's a really key window into how well your kidneys are doing their job. So, what is it actually telling your doctor? Let's break it down. And this is why this is so important. A lot of our body's most critical systems, like our kidneys, they just work silently in the background, 24/7. We don't actually feel them doing their job. And that's exactly why tests like the BUN are so crucial. They give us a peek under the hood, a way to check in on these silent workers and maybe catch something before it gets serious. So what even is urea nitrogen? Well, it actually sounds way more complicated than it is. Think about it like this. When you eat protein, whether it's chicken or beans or a steak, your body uses what it needs to build muscle and create energy. The stuff that's left over from that process, that waste product is called urea nitrogen. It's totally normal, and it just circulates around in your blood. Okay, so that leads to the obvious question, right? If this waste is just hanging out in our blood, how do we get rid of it? Well, this is where your kidneys get their moment to shine. You can think of them as your body's super advanced filtration system. As your blood flows through, they expertly pull out that urea nitrogen and a bunch of other waste products, which you then, get rid of when you go to the bathroom. It's a pretty elegant and absolutely vital process. So why would a doctor order one of these tests in the first place? Well, the reasons are pretty broad. It could be anything from a simple routine checkup to a much more focused investigation. A lot of the time, a BUN test is just part of your annual physical, included in that standard panel of blood work. It's a great screening tool, but it's also used to keep an eye on how treatment is working for people who already have a known kidney condition. Or it might be used to figure out what's causing specific symptoms that could point toward a kidney issue. And this also explains why your doctor might suggest a screening even if you feel perfectly fine. You see, certain things can increase your risk for kidney problems down the road. Stuff like a family history or having diabetes or high blood pressure, all these things can put extra strain on your kidneys. A proactive BUN test just helps everyone keep an eye on things. Okay, so you're scheduled for a BU test. What's that actually like? Well, I've got some good news for you. It's one of the simplest, most common medical tests you can possibly have. Let's do a quick walkthrough. Honestly, the whole thing is incredibly straightforward. For prep, you usually don't have to do anything special, like fasting. Then there's the blood draw itself, which takes like less than 5 minutes. It's just a small sample from a vein in your arm, and as for aftercare, you might get a tiny bruise, but that's pretty much it. It really is that simple. All right, now for the part everyone really wants to know about. What do the results actually mean? You get that report back, you see a number next to BUN. What is it telling you? Let's decode it. But before we dive into the causes, it is absolutely crucial to know this. There isn't one single normal number for everyone. What's considered a healthy range for, say, a 25-year-old man is going to be different from the range for a 7-year-old woman. Your lab report will show you a reference range, but only your doctor can tell you what your specific number means in your personal context. This shows just how wide the variety of potential causes can be. A high level can mean that your kidneys aren't filtering waste the way they should, but it could also mean something as simple as you're a little dehydrated, or maybe you're on a high-protein diet. And on the flip side, a low level might point to a lack of protein in your diet, malnutrition, or even issues with your liver. You see, this is why context is everything. And that's exactly why it is so important not to panic. An abnormal result does not automatically mean you have a big medical problem that needs treatment. It's better to think of it as a clue, not a conclusion. It's just a single piece of information that tells your doctor, hey, maybe we should look a little closer here. And that brings us to maybe the most important point of all. A BUN result never, ever stands alone. Your doctor uses it as just one piece of a much larger health puzzle. Yup, the BUN test is a total team player. It almost always works together with other tests to give your provider a really complete picture of what's going on. Its two most common teammates are the creatinine test, which measures another kind of waste product, and the GFR, which is basically an estimate of your kidney's overall filtering power. Now, here's the really interesting part. Doctors look at BUN and creatinine together. Why? To help rule out things that aren't related to your kidneys. For example, if your BUN is high but your creatinine is normal, that might point away from a kidney problem and more towards something like dehydration. It's that combined view that gives them a truly reliable picture. So, if you remember just one thing from all of this, please let it be this. Your lab results, they are the start of a conversation, not the end of it. The numbers are just data. It's your doctor who provides the meaning, the context. They are, without a doubt, your best resource for understanding what these results mean for you. And that kind of leaves us with one final thought. Understanding your own health is incredibly empowering. Knowing what tests like the BUN are actually for helps you be a more active partner in your own care. So maybe it's time to ask your doctor about your kidney health.